Welcome to the channel Future Ready Doctors.
I don't want my clinic to have a provider tag in front of my practice. I'm not a provider.
Some orthodontists these days are giving aligners like toffees to chew.
Now what happens over here? Profitabilities of the company, who is at loss? Insecurity in dentists is very high. We should not be scared of our own fraternity.
Even in the medicine and dentistry and orthodontics, what kind of a leadership do we require? So the trident of medical leadership, if I may say so, is that one blade of the trident is clinical leadership. The other blade of the trident is the academic leadership. The third blade, which is often not given credence. Yes, I'm talking about the entrepreneurial leadership. The leadership wherein the doctors take the charge from within the community, come up and take the baton of change.
The biggest problem is in entire medical sciences mistrust.
AI is very promising for the healthcare per se. Our diagnosis and treatment planning can be faster. AI can act as a research assistant. It can help us into having better differential diagnosis. And then one thing we need to incorporate in our medical education system is entrepreneurial leadership, that how to get the funding.
Now I will differentiate between taking a loan and taking a funding.
Coming back to leadership, what kind of a leader you feel you are?
The person sitting on top of the pyramid and the base of the pyramid should be treated equally. What do you think as leadership?
It's not, tables are turning.
Yeah.
So you are consciousness leadership. Dhruva, I tell you, there have been certain events in my life recently. I realized that we need to be a part of a community. We need to grow as a medical fraternity together. We are. But are we there in our tough times? Are we there when we are not at the peak of our careers, but in the valleys? And see, as a doctor, you also know that we are juggling many balls. Health, wealth, business, relationship, patient management, team management. It's not possible to be at the peak in all the phases all the time. We have our own shallows.
Exactly.
Do we have a set of 5 friends, 10 friends who are there for us? Are there, suppose we have Indian Medical Association, we have Indian Dental Association. Are there any healing programs going on? Are there any psychological therapies available? Do we have coaches who are acting on our quote-unquote frequency, vibration, health, mental health, sound healing? Recently I realized that when the medicine started, they used to call डॉक्टर साहब के हाथ में शिफा है, छूते हैं ठीक हो जाते हैं. Many doctors must relate with this, that डॉक्टर साहब आपकी स्माइल देख के ठीक हो जाते हैं. 80% तो आप पर्चा लिखते हैं, वो तो अलग चीज़ है, वो तो 20% है. 80% तो आपके चेंबर में देख के खुश हो जाते हैं. अब वो जो शिफा था, वो जो हीलिंग फोर्स हमारे थ्रू जाके पेशेंट को हील कर रहा था, अब अगर डॉक्टर ही डिप्रेशन में है, डॉक्टर ही, एंड सी वी आर ह्यूमन बीइंग्स, राइट? पीपल माइट बी हैविंग हेल्थ इश्यूज, रिलेशनशिप इश्यूज, सर्टेन इश्यूज. सपोज पर्सन डॉक्टर ए, डॉक्टर बी. डॉक्टर ए कार्डियोलॉजिस्ट हैं दोनों, सपोज मिस्टर शर्मा एंड मिस्टर वर्मा. डॉक्टर शर्मा जो हैं वो डिप्रेशन में हैं, तो हौले हौले आ रहे हैं, ये वो ठीक है, मैं डॉक्टर हूँ तो उनकी अनकॉन्शियस कॉम्पिटेंस है कि वो आके ट्रीट कर सकते हैं. वर्सेस डॉक्टर बी, डॉक्टर वर्मा, वो जॉली हैं, परेशानियां लाइफ में सबके होती हैं, बट मेडिटेशन किया अपना थोड़ा, रीडिंग सम मोटिवेशनल लिटरेचर, इज हैविंग अ गुड सेट ऑफ फ्रेंड्स. एंड देन व्हेन दिस हैपेंस, who is the doctor you would like to go to as a patient?
As a dentist, when we want to understand that we want to grow big. Now, entrepreneurship in dentistry is entered, and people want not to be just called as a local dentist, a term hota hai pass wala dentist. People want to be big, and when I understood that I want to do something bigger than dentistry or bigger in dentistry, I made sure one thing which I want to do is I want to make a team. I cannot do everything. You were mentioning about some dragonfly effect. What was that?
There's a lily in a pond. A lily. They have many small crawling insects below. Went up, started crawling, and now there's this interesting phenomena that when the sunlight hits this insect, the wings expand and it turns into a dragonfly. And the dragonfly, earlier it was in just 2 dimensions. Now it has a whole set of dimensions opening up. It can see the sky, it can see right, left, up, down. It can fly. The basic point of the story is that growth requires courage. Firstly, everybody wants to become a dragonfly, but do we have the courage to go into the domains of entrepreneurial leadership, to take the risk, go up? Secondly, do we have that intention to serve? to come, try to help people by creating systems, processes, companies, learning management systems, platforms, and thirdly, most important, a guilt-free existence. Not feeling bad within yourself. What is your personal philosophy with regards to use of business when we talk about medical practices, dental practices, how to run the clinics like a corporate? What kind of a leadership do we require? What do you feel has changed over time?
Let's begin.
Hello, future ready doctors. Welcome to the channel Future Ready Doctors, empowering the doctors of today to lead the healthcare of tomorrow. Friends, the aim of this channel is to bring the best doctors, best people who are stakeholders in the healthcare field on the main stage to share their pearls of wisdom. And today's podcast is really special because I have one of my friend, Dr. Dhruva, coming on this podcast. And as I was experimenting, right? I was experimenting with my thoughts that how should we set the context for today's podcast. I came up with a very nice awareness just today morning while I was meditating. And in the meditation, I had an awareness that what do we need next in the whole medical fraternity, generally as a generalization, and also in the field of orthodontics, which is a specialty of dentistry. I came up with a framework that is the Trident framework of leadership, and that's what we are going to discuss today. And the Trident framework of leadership is applicable across the medical domain, whether you are a cardiologist, nephrologist, from any domain of medicine and specifically in dentistry. So it is like a trident has three blades. So the trident of medical leadership, if I may say so, is that one blade of the trident is clinical leadership. So there are many doctors, or a majority of us, who are excelling in their clinical world. They're having their clinic set up, their systems, processes, maybe a corporate kind of a setup, a corporate hospital, all of these things. They are actually helping patients heal, spreading healing, spreading health around. The other blade of the trident is the academic leadership. Our senior lecturers, readers, associate professors, head of departments, and they are heavily into research, randomized controlled trials, systematic reviews, meta-analysis, and they are creating a body of evidence which is supporting the clinical field. And not to forget, they are creating the second line of leadership. They're teaching the students, they're teaching the medical students, the dental students, and creating the human resource for supporting the healthcare. But friends, today's podcast is not specifically about the clinical leadership or the academic leadership. It is about the third blade, which is often not given credence. Yes, I'm talking about the entrepreneurial leadership. The leadership wherein the doctors take the charge from within the community, come up and take the baton of change. Maybe they open up a company, maybe they open up a products company to support the doctors, an imaging company, maybe a chain of diagnostic centers, maybe something or the other to help the doctor fraternity either in the clinical leadership or in the academic leadership. So with that, let me introduce our today's guest, Dr. Dhruva, who is into the entrepreneurial leadership, if I may say so. And he has his own journey. He is having his own learnings along this journey of the entrepreneurship. And let's decode his mind. Let's decode his journey. Let's decode his experiences, that what he is going through. And let's try to embody that in our life. And as we are going through this journey of this podcast, I would like all of you to ponder over three questions. The first question is, when you see around yourself, and you can do this even if you are a medical student, by the way, when you see around, what kind of a leadership you see doctors playing? Are they totally into a clinical leadership? Are they into an academic leadership? Or are they into an entrepreneurial leadership? Yeah. Secondly, you can think about what kind of a leader you are. So you can sit in silence, take a deep breath, and think about what kind of a leader are you. And thirdly, you can think about what kind of a leader you choose to be in the next 3 years, 6 years, or 9 years. and you can set the tone of your life according to that. And when you're having these three awarenesses based on these three questions, you will be actually able to absorb this podcast in a better way. So with that, let me introduce Dr. Dhruva. Brother, welcome to the podcast. And although we usually meet in very casual settings, so I am finding a bit of not trouble, but a different kind of a frame of mind introducing you. But welcome to the podcast, and please accept my great gratitude.
Thank you so much, sir, for inviting me over. And for me, it's also slightly, difficult to see you in this new avatar of yours. And the way you are explaining things, it's superb. Although I've been listening to you since a long time, but seeing you in presence, it's a different aura altogether. And thank you for having me over. And hopefully we do justice to our time and to the viewers.
Yeah. So Dhruva, on that note, let me ask you, since the context is leadership, right? And if you see around the world, not just orthodontics per se, not even medicine for that matter, around the world is in a chaos. Things are happening, wars are happening, people are fighting amongst each other. There is no unanimous agreement on anything for that matter. In this phase of the world, we need strong leaderships. And if you see, even in the medicine and dentistry and orthodontics, which we are a part of, what kind of a leadership do we require?
See, first of all, we need to have a leadership which is selfless. We need to have somebody who doesn't think about their own motive first and want to put in front of, a prospect of benefit for the mass. The profitability should not be of the self person. And the other thing which is required is which I also believe in a very strong way, and which I have also learned from my seniors, that you should move with, every person with you should just be hand in hand with you. There is no hierarchy in leadership. Although always there is a pyramid when you are working, but I always believe the person sitting on top of the pyramid and the base of the pyramid should be treated equally. And when you are growing and when you want to achieve something, the benefit should be from the top till the bottom. And it should be selfless. And it should not be me all the time. If the growth has to happen, it has to happen for everybody. And the growth should be for the betterment of the society. Not for some self person, team, or a company, or an association, or a society. The growth should be what it matters to mass. And we should take mass in consideration, grow better, and succeed in life in a better way. So for me, that is a leadership which is there.
Great. And as you were saying this regarding, I got some elements of a servant leadership, wherein we are leading from the front, and we are not like a leader. We are pushing people. We are pulling them into our mission and what we believe in. And also, you mentioned something like masses. It should cater to masses, not just be about profitabilities and numbers and Excel sheets, but about those human beings, the souls who we are going to serve, and not just they being a number on the Excel sheet.
Exactly.
Like 400 patients done, 10,000 patients done. That is a part of it, yes, statistically. But the soul of medicine, the reason why we became doctors, right, to help people, to serve people. And especially when you must also have had those experiences when randomly a patient would give lots of gratitude for the change he has experienced through our work. And I had one incident wherein when I was an intern in the college, one of the patients just said, Dr. Saab, can I give you some blessings? I said, fine, this was a new experience for me. So he just held my hands, blessed me, had his hand on my forehead. And it was a very, a part of me shifted that day, that we are doing something big. We are doing something big. We are part of something big.
And on the same context, I'll add something which really moved my life, a same kind of an experience, like a patient-based experience. So this is COVID, 21, second COVID. Just we've finished, reopened our practices, and we used to do just one half. So what we had divided within ourselves, one time one doctor will be there, first half I will be there, second half somebody will be there, next day first half somebody will be there. So we had divided so that everybody gets a freeway time so that they can understand they're well or not. So I was just wrapping up my practice and I was leaving for home. So my associate staff was there. who takes care of the reception and patient management, and he said, "Ki sir, there is a guy on the gate, and he says he wants to show you." Show you मतलब he wants to show you only.
Okay.
कहते कि तो आई टोल्ड हिम, मैंने कहा मैम आएंगी 2 घंटे बाद, मैंने कहा तब दिखा देंगे. एंड आई वाज डन. You must be remember we were wearing those PPE.
I was about to mention that it was COVID times, for God's sakes. COVID times, yeah.
And he said कि सर वो ना हाथ जोड़े खड़ा है एंड कहता सर मुझे लगता भी नहीं कि वो ट्रीटमेंट कराएगा. आप बस ऐसे ही ना गेट पे ही देख के उसको बोल दो कि मुझे हो जाएगा कि मैंने उसको.
And that time the people were having fear of death. Fear of death, yeah.
Then and I saw from my office I can see the entire practice. So we have one 2-floor practice, so I could see that he's not even sitting. He's standing at the entrance as you enter the practice. He's standing there and he has got a jhola in his hand and he's standing over there, and I told him, मैंने कहा यार he will not be able to afford us. एंड ही सेड कि सर देख लीजिए सर, मैं 15 मिनट से इसको भगा रहा हूँ और वो बार बार ये कह रहा है कि मुझे डॉक्टर ध्रुव से 2 मिनट बस. सो देन ठीक है, मैंने सो आई वोर माई पीपी अगेन. आई कुड नॉट वेयर द सेम थिंग. आई वोर अनदर वन,
द होल कमांडो ड्रेस,
फेस शील्ड, हेड cap, and I walked down and so there's another consultation room and I sat down with him and he said, so, and you will not believe when I was walking down I was like, I'm wasting my time यार, मतलब what am I doing? तो I thought I'll just go and tell him कि आप hospital चले जाइए, कहीं और चले जाइए and all those things. And he saw and he started hold his hand, सर नमस्ते, आपका सुना है, इसने बताया, उसने बताया, ये बताया, वो बताया. ठीक है. तो and उसने झोले में हाथ डाला and he took out CBCT X-ray films. And I was like, and when he approached me, he took out his slippers. Slippers were torn. वो बाटा वाली कैची चप्पल.
Got it.
The slippers were torn and I was looking and I was like, what is this happening? And he gave me his CBCT reports. And I saw it and he said कि सर मुझे full mouth implant कराना है.
Okay.
And all this time I was just, I was getting angry and frustrated in myself. What I am doing, I'm supposed to go home, and I have to leave. These guys also have to leave. The next batch has to come. So we had a rule कि nobody overlaps. So and all of a sudden मैं कहा ठीक है, मैं कहा बैठिए. तो and I said मैं आपकी हड्डी नहीं है, मैं कहा नीचे का हो जाएगा, ऊपर all on 4 रहेगा, ये है वो है, तो X amount in lakhs इतना बैठेगा. And he said कि मैं दे दूँगा. And तो फिर देन आई वाज लाइक, मैं कहा ठीक है दे देना. तो नहीं टोल्ड हिम, मैंने कहा इतना बैठेगा क्या? हाँ सर मैं दे दूँगा. तो मैं कहा ठीक है फिर. तो मैंने कहा देखो अभी तो नहीं, मैं कहा थोड़ा हफ्ता 2 हफ्ते रुको, इमरजेंसी है नहीं, टेंशन पहन रहे हो वापस आप. After 2-3 weeks he came back again. He brought his entire checkbook. He divided the entire checkbook 50,000 rupees and he gave me 8 checks. And he said कि सर ये रख लीजिए, बाकी जो होगा मैं आपसे ले लूँगा. आप हर महीने 1 चेक अपने आप काट देना और जब तक मैं आपको पूरे पैसे ना दूँ तब तक आप मेरा काम पूरा मत करना.
Got it.
So then I realized कि मैंने कहा कि this man is pretty serious. And then I asked him, what do you do? क्या सर, I'm a guard.
A guard.
And I do 3 shifts in a day.
Wow.
Morning shift in a bank, afternoon shift for a printing press, and evening shift same bank ATM.
Okay.
कहता I only go 2 hours at my place. And मैंने कहा कि why are you, मैं कहा आप डेंचर पहन रहे हो क्या? नहीं सर मुझे फिक्स चाहिए. And that man paid me the entire amount. And then I realized after doing his surgery, I called him up and I said कि मैं कहा देखिए मेरा ये काम है और मैं आपके लिए इतना बेस्ट कर सकता हूँ. I reduced the price very considerably, but that day it made me realize कि how importance of us in patient's life is, and when a patients want a quality life, to what extent he can get. See a guard having 3 jobs, 2 daughters to get them married, and he coming up and that day I realized कि मैं कहा, and entire treatment I was just thinking मतलब मैं कहा प्लीज़ भगवान इसके काम में कोई ख़राब नहीं होना चाहिए. And I went out of the way. I placed better implants for him, and I gave him. Although I had convinced him for a PFM denture base, I gave him a hybrid. So my guy, and it was so warming, and every time he comes back, he will always come with some gesture. घर की बनी हुई छाछ. तो he said कि उसकी wife किन्ने छोटी सी डेयरी बना रखी है, दूध लाएगा. And it's really moving, and that made me realize that if we sit down with the patient, make them realized, and the biggest problem is in entire medical sciences is mistrust. If we can introduce that trust in our patient, I think 90% of the treatment is done. And I think we as a medical fraternity, you really sit down with our patient, and what I specifically do, I'll just for my practice is, if I fail, the rare incidences, I will explain my failures. And whereas what happens specifically in dentistry, people don't accept their failures to their patient, and they start blaming the patient कि ये आपकी गलती है. See, if you place an implant fails, 10% of the chances that body might not take it, 90% it should. If it doesn't pain, a lot of time I have seen dentists criticizing patients. No, we should sit down with our patient, we should talk to them, so that they have a faith in us, so that we can attempt second time. If not in us, then to the other person, that at least they can say the other dentist could not, or the doctor do not do it, you do it. I think this is the mistrust of a doctor inside the entire population, not in India, I've seen outside also. That trust should be built, which I think we are lacking a bit.
And as you say, I realize that you have made a very valid point, that many a times if some things go right and left away from the actual outcomes we want, there's an inherent tendency of slipping it below the carpet in certain ways. But if doctors sit with the patient and come to the facts that this was decided, intentions were all aligned, somehow due to certain variables which are always there in a medical practice or a dental practice for that matter, some things we have achieved, some things we were not able to achieve.
Exactly.
Right? So we are happy for what we have achieved, and we can work upon as a team, as me and you, as a doctor and the patient, co-creating a result.
Exactly.
So that can be a good way to approach things. And thanks a lot for bringing this point, because I can also dissect on this in later podcasts, that how we can improve our thought process. Because see, doctors might be having their own fears, by the way. That if I say something and the patient takes it in a not so welcoming way, then it may backfire. So because trust goes both ways.
Exactly.
Yeah, so thanks for bringing that point, by the way. Coming back to leadership, what kind of a leader you feel you are?
So for me, I believe in one thing, I am somebody, supposedly if I have to tell my guy what has to be done, so I am somebody who will sit down first and do it myself. And I want to be in that person's shoe to understand how good or bad he can do, most of the times. So I am somebody who likes to take people equally. I believe in, so I tell everybody in my office, from the person who is a housekeeper, we have got a housekeeping 2 person in our office, from there to me, everybody is equal. And I tell them if they have issues, I tell them their importance and my importance in my entire ecosystem is equally important. I like to take everybody equal. Everybody has to be taken in consideration, and I am somebody who will put myself forward rather than blaming some other person. If there is something it's not going right, in fact it might be going on field, I'll go myself. If I fail, I'll discuss with them why we failed, how we can improve, how we cannot improve. And if I am been able to do it, I always tell this to everybody, whomsoever I meet, I am not someone who is very intelligent. I am not someone who is very smart. I am a very average person. And I always say, if I can do it, anybody can do it. And always I tell in my team, because I am in every role to my, in my both the worlds of ecosystem. And I do everything. And I tell them, I can do it. You can do it. And I will always make sure that I am contributing equally to what they're doing.
Wow.
So for me, this is and leadership kind of a thing. What do you think as leadership as a point?
I mean, it's not, tables are turning.
Yeah.
So you asking me a question and wow. Okay. Can you repeat the question?
What do you think? What according to you, what is leadership as such?
Wow. First of all, thanks for sharing your version of leadership, because many of our viewers, they mean doctors, medical students who are watching this. Recently, I'm watching a lot of podcasts where army people are being invited, and I'm really inspired the way they lead, because that is ultimate leadership. They know that they have to go into enemy land, and life and death is involved. A part of that is in our leadership as well, because we are also dealing with some similar scenarios at times. The way they lead, what I have understood is that they, as what you mentioned, first do it themselves.
Yeah.
And only then, as officers, when they are putting themselves in the front lines and then having an open discussion about their failures and their wins, only then the JCOs and all the Jawans, they have that inner calling to follow them. So that is what I'm decoding from your kind of leadership that you have mentioned, and I totally resonate with that. And as you're mentioning this, you mentioned something about the circus, and I totally believe in that.
Yeah.
So the basic idea of circus for me is having fun. And you must recall that when you were entering the studio and we were setting things up, I asked you, how are you? And then we were joking around that if I'm saying I'm happy, it should be evident on the face, like I'm happy, right? So might be at times we are saying words and not feeling them.
Exactly.
And in a circus, everybody's feeling. Yeah.
So everybody has their own role.
Yeah.
Their entertainment role, maybe you can say. And if they do their role perfectly, it's all happy.
Yeah.
And life is good.
Life is good.
Life is good.
Yeah.
And if I always tell everybody, the people I find, like I was, me and sir were sitting one day and we were like, sir, ye nahi ho raha. We were just discussing on Excel sheet wali part.
Yeah, yes.
And so then one of my associate orthodontists was sitting over there and she was like, ki, sir, मैं परेशान हूँ. तो I was like, बता क्या परेशानी है? सर वो वहाँ जाना है, तो उसका हाउस वार्मिंग है, फिर उसके बाद मुझे वहाँ जाना है, वहाँ जाना है. मैं कहा ये तो प्रॉब्लम जिंदगी की है ही नहीं. मैं कहा जिंदगी
ट्रू, वेरी ट्रू.
मैं कहा ये तो जिंदगी की प्रॉब्लम है ही नहीं. मैं कहा जिंदगी की प्रॉब्लम तब आती है जब आपके हाथ में रोटी ना हो.
वाओ, वेरी नाइस.
घर पे छत ना हो. मैं कहा माय फादर यूज्ड टू से जब तक छत है और तुम खाना खा सकते हो, यू आर अ रिच पर्सन.
वाओ.
क्योंकि बाकी चीज़ें बाद में आती हैं. माई elder cousin is very successful and he says jokes to me a lot of time because he has a lot of good collections of cars and he comes by, he told me once क्या ध्रुव 20 लाख से ऊपर की गाड़ी मुझे सारी की जैसी लगती है. तो मैंने कहा अच्छा. कहता हाँ यार कुछ मुझे फ़र्क ही नहीं लगता. कहता मे बी इन करोड़ ऑल्सो. क्या आई फाइंड देम इक्वली सेम. क्यों, क्या मोटिव तो वही है ना, कंफर्टेबल, सेफ्टी और मुझे डेस्टिनेशन पहुंचा दे. क्योंकि देयर इज नो एंड टू लग्जरी एंड इफ माय बेसिक नेसेसिटीज, यू विल नॉट बिलीव, so whatever I have, I just keep 20,000 for myself, for my salary. I can survive in 20,000 a month.
Yes.
Why? What do you need? I've got a house. I've got my few duties as a son. I take care of the household things like paying salaries वगैरह. उसके अलावा what do you need? There is no end. You can go and stay in luxurious hotel. You can party and everything. There is no end to it. But as a human being, to be happy, you should have a family, have a house, and basic good food, सात्विक खाना खाने के लिए होना चाहिए. That's I am happy with that. बाकी जो जिंदगी में आएगा वो किस्मत है ऊपर वाले की देना है. I'm happy that way. I'm very happy.
I'm really happy having conversation on this domain, in this domain, by the way. And this reminds me of your question, what you asked. And now I have a better answer to give, because now as you asked this question, although I was not prepared for that, so I was still thinking, okay, what is my kind of leadership? So taking points from you, I totally believe that as doctors, whatever is being taught to us throughout our academics, be it like primary school, coming all the way to actually maybe medical colleges, dental colleges, there's some things which are lacking. So we are trained how to do surgeries, how to treat patients. That part is given in much detail. However, how to manage practices, how to manage ourselves in the practices, how to create teams, how to lead the teams, because it's a teamwork at the end of the day.
Exactly.
And I believe this conversation has been divinely guided, because all the dots are connecting regarding the army kind of leadership, regarding servant leadership, regarding a circus in a fun kind of a leadership wherein everybody is happy. So recently I did not have a talk with you regarding this thing. I have started a company, Future Next Labs, and this is around spreading awareness, readiness, empowerment, and creating products and solutions around AI and consciousness.
Oh, great.
So like I feel very happy when I talk about this because it's very close to my heart. So AI, because I feel that we all need to be AI ready.
Yes, we need.
Right. There are two poles. One is they are saying AI is very bad. AI, it will eat away the world. It will be end of civilization. That is one pole. Another pole is that AI is some snake oil or a magic pill. Right. But in the middle of it, if we see, AI is very promising for the healthcare per se. Exactly. Our diagnosis and treatment planning can be faster. AI can act as a research assistant. It can help us into having better differential diagnosis.
Exactly.
And then having a repository of research for every patient. So we can recall that what we have done, why we have done, and all the latest research can be at one place. Exactly. And I'm also working on a clinical decision support system such that, see, the basic, one of the guests I had on my podcast, he said that even after 20 years of being in his practice, he feels that he is not connected with academic literature anymore. So there, as a doctor, sometimes what happens, most of the times, but sometimes what happens is that we do not go back to the articles, the latest guidelines. Exactly. So how AI can keep you updated with the latest research so that now the patient that you are doing today, you have all the awareness of the research that is happening. And by the way, it's a win-win. It's a win for the doctor. You feel happy that you're doing good work, most updated work, and also for the patient.
Patient gets justice.
Yeah, so I'm very passionate about this thing. And it is stemming from the emotion that at times we as doctors are sent into the world with a noble cause, but we are not updating ourselves regarding our practice management skills, regarding our team building skills, leadership skills, and AI also in marketing, branding. In content creation. The irony, Dhruv, is that doctors are becoming content creators and they are doing less patients and more of content creation. How AI can systemize and automate everything so that we can do what we are supposed to be doing. So that is one thing. And second thing, the leadership is, so I can call this AI leadership. And second is consciousness leadership. Dhruva, I tell you, there have been certain events in my life recently. I realize that we need to be a part of a community. We need to grow as a medical fraternity together. We are. Yeah. But are we there in our tough times? Are we there when we are not at the peak, the peak of our careers, but in the valleys? In the valleys. And see, as a doctor, you also know that you must have also felt that we are juggling many balls: health, wealth, business, relationship, patient management, team management. It's not possible to be at the peak in all the phases all the time. Exactly. We have our own shallows. Exactly. Do we have a set of 5 friends, 10 friends who are there for us? Are there, suppose we have Indian Medical Association, we have Indian Dental Association. Are there any healing programs going on? Are there any psychological therapies available? Do we have coaches who are acting on our quote-unquote frequency, vibration, health, mental health, sound healing? Recently, I realized that when the medicine started, they used to call डॉक्टर साहब के हाथ में शिफा है, छूते हैं ठीक हो जाते हैं. आप some of the patients, you have a beautiful smile by the way. So the patients used to compliment me, and many doctors must relate with this, that डॉक्टर साहब आपकी स्माइल देख के ठीक हो जाते हैं. 80% तो आप पर्चा लिखते हैं, वो तो अलग चीज़ है, वो तो 20% है. 80% तो आपके चेंबर में देख के खुश हो जाते हैं. अब वो जो शिफा था, वो जो हीलिंग फोर्स हमारे थ्रू जाके पेशेंट को हील कर रहा था, अब अगर डॉक्टर ही डिप्रेशन में है, डॉक्टर ही, एंड सी वी आर ह्यूमन बीइंग्स, राइट? पीपल माइट बी हैविंग हेल्थ इश्यूज, रिलेशनशिप इश्यूज, सर्टेन इश्यूज. सपोज पर्सन, डॉक्टर ए, डॉक्टर बी, डॉक्टर ए कार्डियोलॉजिस्ट हैं दोनों, सपोज मिस्टर शर्मा एंड मिस्टर वर्मा. डॉक्टर शर्मा जो है वो डिप्रेशन में है, तो हौले हौले आ रहे हैं, ये वो ठीक है, मैं डॉक्टर हूं तो उनकी अनकॉन्शियस कॉम्पिटेंस है कि वो आके ट्रीट कर सकते हैं. वर्सेस डॉक्टर बी, डॉक्टर वर्मा, वो जॉली है, परेशानियां लाइफ में सबके होती हैं, बट मेडिटेशन किया अपना थोड़ा, रीडिंग सम मोटिवेशनल लिटरेचर, इज हैविंग अ गुड सेट ऑफ फ्रेंड्स.
Exactly.
Dr. Ajay Sharma came on the first podcast, and he mentioned about regarding social connect,
Social connect.
the
Exactly.
pill of social connect. Are we socially connected? And then when this happens, who is the doctor you would like to go to as a patient?
As a patient.
Or Dr. Sharma or Dr. Verma? All regards to Dr. Sharma.
Hey, but there's one more thing I just want to add over here is ki, like as a doctor, what you said, we wear a lot of hats.
We wear a lot of hats.
That is so one of my staff, so she came up to me and said one day कि सर आपकी split personality है क्या?
Thanks for touching that point.
हाँ.
Sometimes I feel I have a split
हाँ,
personality.
split
Please elaborate on that.
So I was just looking at her. So she's been working with me since more than 4 years, and so she's quite open to me. Like open to me that most of the people don't ask me such questions, but she can
ask you things which other
in a very
people-
funny way.
हाँ,
We're having
हाँ.
lunch. So she's like कि सर आपकी split personality है क्या? I was said something. अरे क्या हो गया? कह रहे सुबह आए आप गुस्से में थे.
हाँ.
फिर आपने पहला पेशेंट देखा और जब आप पेशेंट से बात कर रहे थे आप हंस रहे थे.
हाँ.
ऐसा लगा भी नहीं कि आप सुबह इतने गुस्से में आए हो.
हाँ.
उसके बाद अगला पे उससे आप हिंदी में बात कर रहे थे, अगले पेशेंट से आप इंग्लिश में बात कर रहे थे, और अभी आप फोन पे एक पेशेंट से बात कर रहे थे और आप ये बात कर रहे थे बीजेपी कांग्रेस के बारे में.
Wow.
कहते ये कैसे कर लेते? तो मैंने कहा सी इट इज़ नॉट अबाउट मी वेयरिंग मल्टीपल हैट्स. मैंने कहा मेरे उस पेशेंट से वो कांग्रेस बीजेपी में है ना मैं कांग्रेस बीजेपी हूँ, बट क्या है फॉर मी टू ब्रेक द आइस बिटवीन हिम एंड me
Yes,
and him.
yes.
मैं कहा he called me after 3 years. And मैंने कहा the last conversation where what I ended with him, तो इलेक्शन का रिजल्ट आ रहा था, तो वो वेटिंग रूम में इलेक्शन का रिजल्ट देख रहा था. आई रिमेंबर दैट. एंड आई सेड कि मैं कहा सर आपकी सरकार कैसे कर रही है, एंड वी वर डिस्कसिंग हैवी डिस्कशन लाइक पोस्ट ट्रीटमेंट मी एंड हिम वर हैविंग कॉफी एंड लाइक इन माय ऑफिस एंड मैं कहा नाउ व्हाट हैपेंस कि मैं जैसे ही मैंने बोला पेशेंट फेल्ट हैप्पी.
Wow. Happy.
पेशेंट लाइक कि अरे यार इसको तब का याद है.
Yes.
एंड मैंने कहा व्हेन ही कम्स बैक टुमारो आई एम डेफिनेटली श्योर ही इज गोइंग टू ब्रिंग हिज वाइफ, his kids or his parents, which will an extra bonus to me. And I cannot see, and I tell everybody, I like in my house also, like my parents said, one day I said I'm very frustrated. I was just leaving my house, I'm slightly wo. So my father asked me, my mother basically, my mother is like, she wants to talk a lot, she wants to know everything. So she was like कि तू बताता नहीं. मैंने कहा मम्मी मैं नहीं बता सकता, because my work professional life I cannot bring it home, and my work profession should not reflect on my patient.
Wow.
If I am stressed, I am stressed. It is my problem. My patient doesn't has to bear that.
Got it.
But this is something एक मेरे में अभी एक पॉडकास्ट ही पूछा था, उसमें टेम्पोरल लोब स्ट्रांग होने की बात कर रहे थे. तो मैं कई बार बोलता हूँ मुझे लगता है कि मैं ना थोड़ा पागल हूँ, कि मुझे ना एक इमोशन पे ज़्यादा देर टिका नहीं जाता.
Wow.
तो बाद में किसी ने बोला कि दिस अ गुड हैबिट, आपका टेम्पोरल लोब स्ट्रांग है, आपका अल्फा स्ट्रांग है, समथिंग है. तो बट एज अ डॉक्टर ना वी शुड हैव दिस since we have taken up this degree and we have taken up this profession.
Yeah.
I'll tell you one thing. I was telling sir also a few days back also. I have stopped surgeries. मैंने एनेस्थीसिया दिए हुए 1 साल हो गया. I rarely, मतलब very rarely, and before 1 year I was heavily into implants. I was doing full mouths. I was doing single arch, ridge split and everything. The day I realized my consciousness or my time requires me somewhere else.
Wow.
My patient should not be here. I hired 2 more doctors, efficient doctors, and oral surgeon. They will take care. I will be there all the time to take care of it, but I will not touch the patient. Because my frustration, my anxiety, my part of my time going to another part of my business, I stopped doing it. Because what we need to understand कि our patient should not compromise what you are, what kind of a day you had, what kind of a day you had with your at home or with whatever it is. So this is something वो मेरे को split personality मेरी लगती है, but I'm very happy with it.
Well, let me tell you one thing. I'm really enjoying this conversation, and I was not having an idea कि ये ऐसे unfold होगा. So let me tell the audience as well कि most of the guests I have on my podcast are my dear friends. So what is happening actually is कि you may not find an interview kind of a setting, right? An interview kind of a podcast. It is a conversation. So please think of us as two friends sitting on a coffee table, and the moment he says something, I have a super eagerness to share what I'm saying. So at times I feel that I should interject or not. And similarly, what is might be happening with you, I am saying something, you are also having that eagerness to share. So kindly bear with us. I am very sure that you are liking this. I just wanted to share my heart with you. As you said regarding, I would come back to the point that you said you have stopped doing surgeries, because I would like to decode your mind on that. Because often I feel doctors who are stuck in a way that they started with the traditional form of clinic, running a practice that yes, I am the sole operator, I'll go, I'll do the surgeries, I'll do this, I'll do that. But after a decade or so, they realize some of their other superpowers. Right? And now when the other superpower may be entrepreneurial leadership, maybe something other like maybe basically the entrepreneurial leadership, then they find a conflict because the new superpower demands more time, right? And that is a very different kind of energy. That's a creative energy. In that you have to sit, do design thinking, break things down to first principles, reverse engineer them to products and solutions, and then you have to do networking, you have to meet people. Now when you are in that energy and you have 5 surgeries lined up, it's a conflict.
It's a big time.
It's a conflict, right? Then you have that guilt. Am I not a doctor? Like for us, being a doctor means we are doing surgeries.
Exactly.
Right. So that split I have seen in myself as well. So I have kept different days. Like I practice for 4 days, and 3 days I am doing my entrepreneurial or my the journey of a leadership wherein I want to empower the healthcare system through me and through us. Like bringing, setting stages like this podcast, having my YouTube channel, which is building now. My book is coming, Doctor 2.0 next month, which is having all these things. And by the way, I'll quote some of the things that you have mentioned in this thing. So I'm really, and this energy is very different. Right. So I have kept different days to manage that. So you spoke something that is very close to my heart, very close to my heart.
And one thing as a dentist, when you talk about leadership, which we lack is the allocation of work.
The allocation of work.
Because the dentist wants to do everything.
Yes, the fallacy or the illusion of control.
कि मैं उसको बोल दूंगा तो ये सीख लेगा, मैं उसको बोल दूंगा तो ये चला जाएगा.
Wow, please elaborate. I'll share my story. Yeah.
Because what happened, the dependency, because a dentist doesn't want to get dependent. Like Ajay sir, you were talking about, he's running chains.
So guys, we had a power cut, and that's a part of life. And we should be aware that there can be power cuts in our life as well. So we should be ready for that. So Dhruva, we were talking about allocation of work.
Yes. So as a dentist, when we want to understand that we want to grow, we want to grow big. Now, entrepreneurship in dentistry is entering, and people want not to be just called as a local dentist, a term hota hai, pass wala dentist, people want to be big. And, when I understood that I want to do something bigger than dentistry or bigger in dentistry, I made sure one thing which I want to do is I want to make a team.
Team, yes.
I cannot do everything, I cannot sit down with social media team. I cannot sit down, with patients. I cannot sit down with my associate staffs taking care of things or not, I cannot do anything. So first thing, what I have seen as such, all the, most of the dentists who are, maybe slightly senior to me, or maybe coming up in general also, let's say it, they're very scared. If I keep somebody, if I teach somebody, they might run away. And they might open their practice. And, and then I'm gone. Or, they might, open their practice just next door. So a lot of time I'm seeing this insecurity within us.
Insecurity, right?
Insecurity in dentists is very high.
Very high.
We should not be scared of our people of our own fraternity. I till now, I think I must have kept at least 15-16 staff, across genres of dentistry. I have never treated them in a way that they will be a future competition of mine.
Very nice. You're bringing in very, very strong points.
I have had people who said to me, you can work with us, just make sure you don't open up a practice 5 to 10 kilometers within our radius. It has happened with me. Because we are scared. And the time I understood if I have to grow, the first thing what I thought was I have to, make a team.
Make a team.
And what I started doing was I started calling people of whom I knew. So the first thing what I did was this, like what you talk about leadership. So I had a receptionist. I asked her, Mecca, you are not doing a good job according to me. Mecca, I have got another job, a receptionist in another company. I would like you to go over there. Mecca, see, I'm giving you another employment.
Safe exit and a very empathetic exit.
Yeah, but Mecca, one of my cousin's company, you can go and sit as a receptionist. They want you are perfect, near to your house, almost same. I brought a guy. This guy who takes care of my business, and I'm talking about 2018, and everybody's told me not to keep him as a receptionist. A guy, a 5 feet guy, small height, जिसको ना हिंदी बोलनी आती, ना इंग्लिश बोलनी आती, ना बंगाली बोलनी आती, ना बिहारी बोलनी आती. He comes from Asansol, and everybody's like, what you are doing? Mecca, I know him since past 5 years, and I know one thing, that he is the most loyal person to me.
Wow.
Mecca, ये कुछ भी करेगा ना, ये पेशेंट को जाने नहीं देगा.
Wow.
And next 2 years, I worked with him. I worked with him, and I worked with him on his personality. I worked with him, his way of communication. I sent him to a personality development institution. It's here somewhere in Noida. And I sat down, I made his clothes stitched. And his way of communication, his handwork, what he will speak. I used to sit down and I used to tell him, tell me, what are you going to tell a patient about an RCT? What are you going to tell about an implant if no doctor is there? If somebody calls up, होता है ना कि ये कितने का treatment. And today's time, he's taking care of my entire clinical business.
Wow.
The same guy, when my family also, a lot of people said कि यार ध्रुव, come on.
Prima facie, that person might not have appeared as the right choice.
As the right choice, but today he's the best person.
Wow. And this brings me to one of the things, you mentioned two very important things. You used the word business, and I want to discuss about that. And regarding leadership as well, regarding allocation of work you were talking about. So, regarding business is, as a word, has different connotations in different people's mind, right? What is your personal philosophy with regards to use of business when we talk about medical practices, dental practices? Because if you see the internet, some doctors are very aversive with the word business to be used in conjunction with medical practice or dentistry. They would say, their point of view is, from perspective, hey, listen, it's a very noble profession. It's a profession wherein we are healing people, and you should not use the word business. The other school of thought is that, see, it's the way you look at things. The basic principles of running a organization would be the same. You need to have marketing, you need to have branding, you need to have human resource department kind of a thing. You may not consciously create those departments, but as a business, as a clinic owner, you might be having those departments in your mind.
Exactly.
Right. So, do we need to change our terminologies? Do we need to allow ourselves to be okay with the word business? How to bring a consensus with regards to the use of word business as far as the medical profession is concerned?
See, I have a very different view on this. Yeah, I'll very straight away put it forward. Not want to make it very sensational or something. See, I don't see a dental. I will just talk about dentistry. Medical, I not put it at this point. I don't see my clinic as a clinic. I see as a institution. I see it as an organization which has to run on its own.
Okay.
Okay. When I say as an institution, as an organization, because I always tell everybody, in fact the people who are working with me or all my juniors and associates who follow me a lot, I always tell them, we are in a service-based business.
We are in a service-based business. Yeah.
Where we are doing service to people like a restaurant, like a hotel, with a humane touch.
Hospitality bhi hai isme.
Hospitality. With a humane touch.
With a humane touch, okay.
I always tell them ki, make sure when your patient enters, your 50% of your work is one-to-one with the patient, which is the health sector. As a dentist, rest 50% is the hospitality part.
The experience they are having over here.
Exactly. And that comes as a business.
Wow.
वो जो 50% है ना आपका, see, we might do a root canal treatment, basic thing. ठीक है, root canal take 45 minutes, single sitting might take 1.5 hours. ठीक है, अगर 3 sitting में है तो not more than 3 hours of practical work is there. But the patient has to be for lifeline. lifetime. So what has to be take care of that for that lifetime experience, that 50%.
Wow, that's a very good breakdown. Please continue. Yeah.
So that 50% has to be taken in consideration, and to give that 50% experience to our patient, it is a business.
Wow. So let me.
So like I'll add another thing to you,
please.
like a business. What you said. In my practice, I learned it from a very great man where I used to work, where you also came once.
Okay.
Another very great orthodontist.
Very welcoming, very
energetic.
Energetic, and sometimes when you are under the tutelage of somebody who is 10 or 15 years ahead of you, showing more passion than you, then you have that reference point to bring up your game.
I still call him sometimes, sir, कैसे कर रहे हो? क्या पूछ मत. So learn from him also, and partly from him, partly from my experience. I've got 4 doctors working with me at this moment of time. Nobody will talk about money to the patient.
I'm having strong urge to mention the name. So our mentor, Dr. Sanjay Lobe.
Dr. Sanjay Lobe.
And hello, Dr. Sanjay sir. If you are watching this podcast, our immense gratitude to you for shaping a dimension of our lives. Thank you.
So we don't talk about money. The doctor will not talk about money to the patient. That will be that is again an allocated work. I've got 2 allocated people, one male, one female, who is going to talk about money to the patient.
Wow.
A lot of time when money is too high, patient is not able to understand, but still the first initial quotation will always be referred by my staff, and then any doctor, the assigned doctor, might help to break down the price and why the price is that. So that the purpose of this is to make sure that the, like you said, medical fraternity, the part where we need to treat patients, stays different from business. So business is not done by a doctor, business is done by a system.
Wow.
And the treatment is done by a doctor who 90% of the time doesn't even know if the patient is paying or not paying.
Wow.
So that his mindset will never be bothered about what patient is paying.
Very good. So if I can share what I am understanding to what you are saying, and feel free to add on into this equation, we should not get stuck into the vocabulary jargon of whether it's a business or not. Every institution or organization has multiple layers to it.
Yes,
One layer is of actual delivering of the care. That is, we are doing surgeries, we are doing root canal treatments, we are giving aligners, we are giving different kind of things. The second part is human experience, the patient experience. And in this patient experience, it can be done in a systematic way,
exactly,
as a process-driven way. For that, we can keep practice development managers, we can train a receptionist, we can have proper payment plans to make the patient understand and have an informed consent regarding what kind of a payment plan they want to get into. And this all can be systemized. As a business. So business is taking care of the business part of the institution, and doctor is taking care of the actual healing, actual delivery of care.
I'll just add an example to it. You will relate with me very well, and a lot of dentists and doctors around the world will relate. What happens? Supposedly there's a patient walks in, and the patient has to get an orthodontic treatment. Supposedly braces. So braces we will not leave aside, but yes, an actual surgery, supposedly a wisdom tooth extraction. The patient comes with very high pain, there's a high swelling, and the extraction has to be done now. Now what happens if I am the treating surgeon and I tell the patient this has to be taken in consideration, we have to do an extraction and X amount has to be quoted. So now what happens is the patient is sitting on the chair and I am banging my head with the patient or the patient person who is there about money. Because by the time I go and start treating the patient, the energy has been gone inside bargaining.
Energy, yes.
My channelization of energy, the excitement or the goodwill I want for the patient. I will, get an incision here. I'll split the tooth. I'll do this. I will do that. I will give a suture. I might go this suture or that kind of a suture. That is gone. Because why? My entire energy has gone in bargaining with the patient.
Yes. You're very right.
So that is when according to me, I say there's a difference between a business, because that is a business. And another thing to it is, you are a very premium orthodontist. I also believe that, self-belief is very important. I'm doing a very good job. So if I'm doing a very good job, what is the difference between me and the other orthodontist? If I'm because I know I'll give a good treatment, I give a stable occlusion for the patient for the lifetime, and if I'm giving that a kind of a quality care to my patient, I need for me to sustain also for myself. And I need money for that. And I'm not doing charity. So those kind of aspects as a business, they always come in. But as per business, yes, it is a business. 50% is business and 50% is human service.
The equation that you have given, and if I may rightly say that just like an infinity symbol.
Yeah.
So one part of the infinity, one circle is about the actual care, the actual, and I would say, I would like to add some spiritual dimension to it.
Can I add?
Yeah, please.
It's like yin and yang.
Yin yang, yeah, yin yang, the duality,
Exactly.
the opposing.
So they both are merging with each other.
Yeah.
They are getting separated, but they are part of one identity.
They are merging to get separated, and they are getting separated to merge again. Right. So rather than banging our head into the into those two forces, the job of a leader or an entrepreneur is to bring those two forces together and make the system work.
And it should not look that as if it is for business, and it should be in a very systematic way that it's not garish, it is sublime, it is smooth, it is calm, and everybody should be in harmony. That is right. You were mentioning about some dragonfly effect. What was that?
When we were having coffee,
Yeah, that thing.
Yeah, dragonfly. See, this is an amazing concept I learned just recently. And this is actually, as I said that I want to add a spiritual layer, and suddenly you said this. The spiritual layer was basically that we somehow, I feel that doctors are chosen, or people are chosen for their particular things. A commando is chosen to safeguard the frontiers of the nation. The doctors are chosen to spread the healing force of Mother Nature or the cosmos to the life forms. Right? So as far as dragonfly is concerned, it's a concept wherein we feel, suppose I'm giving you a story. There's a lily in a pond, a lily. They have many small crawling insects below, right? And they are looking upwards. The pond has water surface. They're not able to see anything above the water surface. So there's a pond, there's a lily. Half part of the stem of the lily is below the water, and the main cusp is above. Right? All the insects are at the bed of the water body. Now, if we are at the bed of the water body, we are looking up and we are not seeing anything. And there is a folklore in the insect community that if you will go up, the insect brothers and sisters who go up will never come back. Because what used to happen, that if one insect, or a water insect, not the flying insect, but the water insect is crawling, and it climbs up the stem of the lily, and it reaches the upper, the main flower, it will never come back. So it was a folklore, a legend, that you should not go up. If you go up, you'll be gone. So one of the daring insect promised, I'm going up and I will come back with what is there, because we need to understand.
Yeah, exactly.
Now this insect went up, started crawling, having maybe a panic attack kind of a thing at times, and crawling, and reaches just at the intersection where water and air is there, crawls up, goes to the top of the lily. And now there's this interesting phenomena that when the sunlight hits this insect, the wings expand and it turns into a dragonfly. And the dragonfly, earlier it was in just 2 dimensions. Now it has a whole set of dimensions opening up. It can see the sky, it can see right, left, up, down. It can fly, right? And by virtue of the wings expand and it starts flying. But it was a good dragonfly. So it finds, okay, fine, now I have to give these lessons that there's growth over here, there's change over here, there's possibilities of a collective freedom over here.
Exactly.
But what happens is, now this dragonfly cannot swim. So even if it comes to the surface of water, it is seeing the insects below. The insects are not able to see this dragonfly. And even if some of the insects are able to see, they are having judgments.
He is not.
You have changed. Now you have become money-minded. Now you have become this and that. So the lesson, the basic point of the story is that growth requires courage.
Courage.
You may have to climb your own stems in your own lilies, whatever it is, whether it's entering into entrepreneurship, because the basic definition of entrepreneurship is taking risk.
Exactly.
Right. How many of us doctors are willing to take risks?
Exactly.
Right. Because by virtue of the normal human brain or the mind, we want comfort zone.
Exactly.
Right. So, firstly, everybody wants to become a dragonfly.
Yeah.
But do we have the courage
Exactly.
to go into the domains of entrepreneurial leadership, to take the risk, go up, and then allow that change to become a dragonfly?
Exactly.
Secondly, do we have that intention to serve, to come, try to help people by creating systems, processes, companies, learning management systems, platforms, maybe podcasts, videos, whatever is your calling, taking lectures as you're taking lectures about the awareness. And thirdly, most important, a guilt-free existence.
Exactly.
Not feeling bad within yourself for people not understanding, because their time will come.
Their time will come. And I'll add two things over here to what you were saying is.
But thanks for asking the dragonfly thing, because
I could not actually process it that time, so I thought I'll just.
As I am speaking this to you, I am also developing my deeper understanding of it. Yep.
So I'll give it back to so you might see a lot of movies nowadays coming up where they are talking about you're growing up. How you're growing up has an impact to it. So as what I see at this moment of time is one of the biggest reflection to what I have in my system is when I have seen my seniors doing their work. And one of the things which I have seen, like we were talking about you're working with Dr.
Ajay Sharma, yeah.
I worked with Dr. Sanjay Lal. Okay. And another that Dr. Divya who is very close to me and very dear to me. And I always, one thing I'll always give it to them in their entire process when I used to work with them or so nowadays I'm working with a lot of, leading doctors and orthodontists. And I have seen all the great people who are top, they are never shy to share things.
Yes.
Recently we were in Lucknow and there was this very senior orthodontist, might be Lucknow's number one aligner provider, and he shared me a very small point which I doing aligners for 10 years and 5 years all time, I never thought about it.
Wow.
Well, it's for patient management only, but what a point he gave it to me. And the great thing about those people who are on top, they will never shy from speaking anything.
And that is exactly the opposite. What happens is this, if you see Maslow's hierarchy of needs.
Yeah.
So Maslow's hierarchy of needs the base of the pyramid is survival. In the survival, your basic energy, you mentioned something about energy as well. And I really relate with the energy concept. That if the doctor is in the serving or the doctor's energy right now, if that business equation comes into money, installments, then there's conflicting energies.
Exactly.
So Maslow's hierarchy of needs, at the base of the pyramid, the energy is very survival driven. So the thing is that, okay, my practice, my patient, this is my patient, as if the patient is married to me. And the patient should not go anywhere else. If the patient mentions the name of some other doctor, there's anaphylactic shock. How can you mention the name of other doctor? There is back bitching. There is no ethics being followed. But I have seen this common trait in the people who are actually in the entrepreneurship leadership kind of a thing, where they're bridging different domains, and also in the doctors who are having wide kind of a practice scenario, wherein they might be having chains, multiple practices, multiple chairs, multiple doctors working with them. They are very eager to share their stuff.
So they are very eager to share their experiences. I'll share another example. Another doctor common between us, another Sanjay. Dr. Sanjay Arora, what a man he is. So if there are times I'm not there at his practice and I'm in Delhi, and if he wants to, he wants the patient should be seen because most of the time he has patients, overseas patient. He will send it to my practice.
Referral.
And when a patient came, and it was for TMD specifically, and I said, sir, he's asking me to do an implant. Kya kar de? Sir, आपका patient है, कर दे.
True.
कहता भाई तू करे, मैं करे, छोटा भाई तू कर दे.
This brings me back to, as you're sharing your experience, same thing when I'm with Dr. Ajay Sharma. And sometimes I believe it's a blessing to be having reference points and senior colleagues like this. So Dr. Ajay Sharma would always be pushing. You do it, you do this. I said, okay, fine, I want to open a practice here.
Yeah.
You open in South Delhi.
Huh?
You do this.
Huh?
So I find that I feel so expanded
Huh.
vision wise.
Vision-wise.
So it's a blessing to be under leadership who have expanded vision, a willingness to share, and also who have a heart to give.
So like I tell you, like in the very same way, like a lot of my juniors came to Delhi and they were like, sir, clinic का डाले, मैं यहीं डालूं? कह रहे कहाँ डाले? तो I showed them, मैंने कहा वहाँ पे एक vacant space है, मेरे को property डीलर आके बता रहा था, मैं कहा it is going to add your budget and you do it. And then after 2 days another junior calls me up and he says कि boss आपने उसको, तो in Rajasthan we call boss, so senior or boss, कहते boss आपने उसको पास की जगह बता दी. तो मैंने कहा हाँ. तो कह रहे आपके पेशेंट काटेगा. मैं कहा जो मेरा कटेगा कम से कम उसके पास तो जाएगा ना. मैं कहा मैं नहीं ग्रो करूँगा, भाई ग्रो करेगा. तो मैं कहा इसमें डरने वाली बात क्या है?
So I would like to ask you and ask myself as well as I'm asking you, where are we lacking? Is this the, as you mentioned, मेरा patient काटेगा. Similar experience, I was installing the CBCT machine in my practice, right? One of the doctors told me, I said that I have one of a very dear friend, a colleague, he's handling the whole CBCT thing. The patient comes, I just have to see and write, and he does it. So now the doctor suggested me, or quote unquote, poured his trauma or his belief over me, that if you are keeping Dr. X as an associate, then he will be he'll develop a good rapport with the patients.
Yeah.
And then once he opens a clinic in your colony, then he will cut your patients. Again, patient katega. Then I actually told that senior colleague of mine, sir, if you want to grow, you have to have a team. And then if you have to have a team, firstly you should be having a team leader's mindset.
Exactly.
You cannot grow alone. As a human being, you cannot grow alone.
You cannot grow alone.
When a child is born, we human beings, I believe, is the only species जिसमें हमको 4 to 5 years लग जाते हैं to actually
understand what is happening.
इंडिया में तो खैर 20-30 साल लग जाते हैं. so yeah, and if you see horse and all these deers, उनको survival चाहिए. I might be wrong on like numerical figures, but जब horse is born, he has to run. The deer is born, has to run, because otherwise it will be eaten away by the lion.
Exactly.
So the mother deer, whatever it is, pushes the newborn to run because the lion will come.
Lion will come.
In humans, what happens is that you can be for indefinite period of time in the care. So as a human species, we need care, affection, and we need to grow together.
Exactly.
But is this a fault of our education system, wherein, if you see, I will again quickly share one example to support this thing. One of my patient, 12 years old around, comes and says कि सर मुझे एक बात समझ में नहीं आई. Fine, बोल क्या बेटा? क्योंकि see, we orthodontists are very like brotherly and with the teenagers. Yeah. So he said कि I got 52 out of 60, like in his school test. Out of 60 marks, he got 52, and he said I was very happy. I was rejoicing and this and that. My sir said that, hey, listen, suppose Raghav, random name, I don't want to disclose the name. Raghav, there's no need to be so happy. Varun has got 58.
Yeah.
Now, what kind of a psychology are we putting in the mind of children if this person makes a mental meaning that my marks doesn't matter if somebody is ahead of me.
Yeah.
I have to beat this person.
Yes.
There's only one way to reach the top of the pond, that I have to beat everybody. Now, if this person becomes a doctor, a very good doctor, very good surgeon, very good orthodontist, very good cardiologist, now will he be able to keep a person in his team? I doubt.
No.
So where is the fault? Is this a fault in the education system altogether?
See, this is a fault in the growing up, the schoolingship. I always I always joke with my mother. So taking both my cousins from my mother's side and the father's side, I was the most poor in studies.
And you're having a small, like that smile, I'm really liking it.
And everybody thought, down the line, क्या करेगा, कौन क्या नहीं, होता है ना पेरेंट्स को, तो क्या करेगा. सबको मेरी बड़ी टेंशन थी. सबको बड़ी टेंशन. आपको आपकी टेंशन थी कि नहीं थी? मुझे मेरी टेंशन करनी थी. और आज के टाइम पे सब किसी को मेरी टेंशन नहीं है, बाकी की टेंशन है. And see, I think, and I always tell my mother is कि my mother is in education, so she works for a very premium chain of institution, colleges, schools. So, and I was telling mummy the biggest problem is कि we have always been compared, because we are always comparing within in and out of society.
Yeah.
The first comparison your cousins.
Yeah,
मामा के बुआ के
हाँ.
के मैंने कहा आपने जिंदगी भर वो किया.
हाँ.
मैंने कहा तो मैं कई बार उनसे मजाक करता हूँ.
For the mother's reaction, हाँ बोल बोटा बिल.
And like I was just telling her, मैं कहा we should, मैं कहा जिसके 50 आया ना उसको भी सेलिब्रेट करना चाहिए, जिसके 100 आए उसको भी सेलिब्रेट करना चाहिए.
True.
Because schooling doesn't mean your growth in life.
Very nice.
बिकॉज आप बाहर जाइए, यूएस जाइए या फिर यूरोप में जाइए, दे आर, आई वॉज सरप्राइज, वन ऑफ माई नोन cousin child was studying over there, fifth, sixth standard, something like that. They were given a project to make a toy and sell a toy.
Wow. At what age?
I think 9, 10.
Wow.
And they were supposed to upload it on eBay and sell it.
And as you were saying this, coming on to the middle blade of the Trident,
this is from school. The 10-year boy.
The entrepreneurial bent of mind, that code is set.
It's set.
It may not fructify at that point in time in its full elaborateness, but later on, this person, when he goes in the medicals, he would be having that lens.
Lens.
Okay, how can I make it better? How can I make it available even more?
Like, I'll tell you one thing. Like at dentistry, both entrepreneurship wise or where dentists are lacking at this moment in time, like I said, insecurity of the patient. Because we are very insecure कि हमारा पेशेंट कहीं और ना चला जाए.
Yes.
ठीक है. क्यों डरना है?
So are we insecure about our craft or our services? Because see
that comes everything. Our craft, our services, our relationship to our patient. I can vouch down, write it down, set of patients of mine, how bad the pain I have had patient, they said कि सर 3 दिन से कैटेरोल खा रहे हैं दिन में 4 बार, लेकिन हमें आपसे ही कराना था. एंड हमारे पास में भी प्रैक्टिस थी, हमने वहाँ जाके एक्सरे करा लिया, उन्होंने दवाई दे दी, हमने उनको बोल दिया इलाज कराएंगे तो वहीं कराएंगे. ट्रस्ट बिकॉज वी लैक ऑन दैट. पता है सर क्या होता है? आई डोंट नो हाउ मच टाइम यू गिव. फॉर मी गिविंग एन कंसल्टेशन फॉर अ पेशेंट इज एन आवर्स टाइम. मैं 1 घंटा देता हूँ पेशेंट को, और जब मैं पेशेंट लाइक सी स्मॉल ट्रीटमेंट लाइक एक्सट्रैक्शन एंड रूट कैनाल्स, आई डोंट टेक इट. इफ देयर इज अ बिग ट्रीटमेंट लाइक ऑर्थोडोंटिक ट्रीटमेंट, बिग सर्जरीज लाइक डॉक्टर रेखा वर्क्स में, शी डज अ लॉट ऑफ सर्जरीज, एंड आई ऑलवेज टेल देम, मैं कहा सी दिस प्रोसीजर इन्वॉल्व्स अ रिस्क, इट इन्वॉल्व्स अ फेलियर. मैं कहा इफ यू डोंट ट्रस्ट मी, डोंट गेट द ट्रीटमेंट डन बाय मी. And when I say this thing to and when patients are questioning कि ऐसा है वैसा है, I always tell them, I am supposed to do the patient. We are supposed to give you a good result. If I am not able to give it, first of all, I will not pick up your case. If I am saying I can do it, you have to come blind faithed कि भैया ये बंदा मेरा काम करके देगा, and he will be giving me the best of the treatment what is available in the world. Both skill set wise as well as equipment wise and material wise. And I am telling you, whenever I say this line, patient comes back to me with 100% faith. I am not at all bothered how much my nearby dentist is charging, what new practices in opening up. I am never bothered because I have built up a faith in my patient. I spend time with my patient. I have seen a lot of time they will not take records. They will not take OPG, they will not take CBCT, they will start the cases कि भैया आया है patient. I'll tell you one thing, sir, you will not believe, I never start a big case on the same day. Rarest of the rarest time I have started a case of full mouth implant or an orthodontic treatment, the same experience. I will explain them everything. I will explain every damn thing and I'll tell them go read, come back. I'm not even those kind of people who will say don't read. मैं कहा आप गूगल पे जाके जो पढ़ना है पढ़ो, पहले ही पढ़ लो, बाद में मत पढ़ना.
Very nice.
मैं कहा आपको किसी और डॉक्टर को दिखाना है, रेफर करना है, कुछ करना है, करके आ जाओ. अगर आप उनसे सेटिस्फाइड हो आप वहाँ करा लो, अगर आप वापस आना है. हाँ, 1 साल बाद पेशेंट आया एंड दे सेड कि सर वी वेटेड फॉर यू, वी कलेक्टेड मनी एंड वी थॉट दिस इज द राइट टाइम, वी आर इन अ बेटर फ्रेम ऑफ माइंड टू गेट द ट्रीटमेंट डन सिंस यू सेड इट इज अ वेरी सेंसिटिव ट्रीटमेंट, नाउ वी आर रेडी.
And as you are saying this, many of the doctors will relate to this fact because as you mentioned this, I found a commonality because whenever I start treatment, I tell everything to them, and the same thing I say, whatever you want to research, do it. Once we move ahead,
then
let's not turn back. Whatever questions you want to ask, I encourage even the children. You bring your questions, pain, this and that. Let's sort it out once and for all. And so like it all boils down to the kind of trust we can put in the patient, and when we are doing our job properly. Because again, when you mentioned that regarding time that you give in a consultation, I totally believe that we doctors are in an influencer's position.
Exactly.
I call this a white coat leadership. A white coat leadership. And by the way, as this discussion is unfolding, I have decided in my mind to keep the name of this podcast to be leadership in medical space, or something around leadership, because we're talking a lot about leadership. So white coat leadership. So one quick example, many of the patients' mothers, especially mothers, they would come after the treatment has been done, after around 7 years or 8 years for some other treatment, and they would say, Doctor Saab, आपकी वजह से बच्चे का IIT हो गया. And I would say, man, I am not a coaching, right? Like Akash coaching or different coachings. So I was curious, that why are you saying that? So she would say that my son came and you said something to him. And he started believing in that. Maybe I would have said that, yeah, you could definitely crack it and different. So, and he would keep on mentioning that, कि doctor ने बोला है, भैया ने बोला है. So since we are having that white coat leadership, the whole society sees us in a leadership position. Are we giving those 5, 10, 15 minutes extra? Obviously, depending on time availability, but are we developing that connect, that empathy, that trust? And when we have that, one thing is that we are helping them in other domains of their life as well, number one. And then we will not be ever bothered about मेरा patient कट गया, मेरा ये कट गया, because we are not doing treatment per se, we are building relationships. And if we are not building relationships, then we will always be pulling down our brothers and sisters from the profession, and we would feel nobody should go up, and nobody should become a dragonfly.
So what we need to understand, we need to create a connect between us and the patient, like a thought process connect.
Yep.
I say politics, you will have a name, because the name is not because he's doing good or bad, because your thought philosophy matches with that person. But over here, I'm not saying to get very personal with the patient, that also becomes a problem. But when we create a connection between us and the patient will always trust you a one step forward to what you want to do. So this, I think, it's very lacking, and this is the biggest insecurities in dentistry, because they are most of the time scared कि मैं तो कहता हूँ patient चला जाए. मैं अपने staff को बोलता हूँ, कई बार एक मेरी patient, like one of my associate staff said कि sir, I gave 1.5 hours to the patient and the patient has gone. Like, don't worry, they're like fixed FDs.
True.
I always say they're like FDs. What is an FD? You have 5 lakh rupees, you give it into the bank, and 5 years later the bank will return the money with interest. That is FD. तो कहती हाँ. This patient is going to come back 1 year or 2 years later with a spoiled treatment, and that is your time when you charge 2 times and 3 times extra.
Yeah. And one more layer to it. You felt happy.
I felt happy. And a lot of time patients have come back.
Yeah.
And the patient said, hum uske paas gaye the, we were not happy. Because now what happens is, again, if we talk about entrepreneurship, we should create an environment. Sir, clinic खोलना objective नहीं होता. क्योंकि मेरे को ऐसा लगता है डेंटिस्ट या डॉक्टर्स को लगता है कि क्लिनिक खोल लिया, अब कायनात की रिस्पॉन्सिबिलिटी है पेशेंट भेजना. भैया आपके पास पेशेंट क्यों आएगा? आप मैं भी डेंटिस्ट हूँ, आप भी ऑर्थोडोंटिस्ट हो, मैं भी ऑर्थोडोंटिस्ट हूँ. If supposedly I also shift to your place, what separates us? The separation is the kind of ecosystem we give to the patient other than the treatment.
The kind of ecosystem that we give.
That makes you different from the other doctor. I have a lot of seen patient is entering into the practice, there is a dull reception.
Yes, no ambience, light is dim.
आ गए, बैठ जाओ, कोई पानी नहीं पूछ रहा, कोई पूछ नहीं पी रहा. डेंटिस्ट भी आया, कहाँ दर्द है, बताओ. अच्छा, जिससे पहले आपने एक्सरे लो या कुछ लो, पहले ही बोल देते हैं इसके 500 रुपये लगेंगे, इसके 600 रुपये लगेंगे. क्यों? आप पूछो पेशेंट से प्रॉब्लम क्या है, व्हाई आर यू हियर, वेयर हैव यू कम फ्रॉम, कितना पेन है. मतलब कनेक्ट. पहला क्वेश्चन क्या होता है? अच्छा दर्द है, आपके कंसल्टेशन कितना लगेगा, आपका एक्सरे का इतना कर ले. वो पेशेंट क्या
कहेगा, लाइक मटर पनीर, कढ़ाई पनीर, दाल मखनी.
तो ये क्यों करना है?
And as you're saying this, I recollect when I train my reception, especially the reception, because I say that they're coming to meet me, and again they're coming into our space, and you very rightly mentioned the ecosystem that we are creating. When the moment they enter, let them be seen, felt, and heard. Because most of the times, Dhruv, you will agree with me, we are living in a very brittle society. Many a times, a small, like a very minute smile, from the reception or from the doctor
Exactly.
means a world to the patient, because many times if you will say something to the patient, okay, Mr. Sharma, like you're an amazing person. Maybe Mr. Sharma might not have heard that validation from in his family his entire life, and you are the first point of empathy that he is experiencing. And as doctors, as ecosystems, it's our responsibility, it's our collective responsibility to give that connect to the patients.
And another thing to it is that we forget one thing: they are our reflection. Our staff is our reflection.
Yeah.
If our staff is not behaving good with my patient,
Yes.
it is I lack. अगर मैं अपने स्टाफ को ये नहीं बता पा रहा कि the patient is coming, you have to smile and greet the patient, it is my responsibility. He doesn't know what he has to do.
Yes, it's a lack of leadership.
And if my associate doctor is not working with the patient well, if now I have to teach them. The day before yesterday something happened. I was luckily in the practice only, and she came running and said, "मेरे साथ ये हो गया." I said, "Don't worry. I'll go. I'll take care of the responsibility." I sat down with the patient. I sat down with the doctor. Everything was done. And I spoke to him, it should not happen again. Kaisa nahi hoga. So you have to make sure they are your reflection, your secondary staff, not doctors, especially the support staff. They have to be well trained and groomed as you are. They should reflect your personality. Their personality is zero in the premises. It is you who should be reflected through them.
As I'm talking with you, Dhruva, I'm realizing a strong need of not just the CMEs, that is, and the CDEs, the continuing medical education programs and the continuing dental education programs. There's a enhanced need of training our staff, our whole ecosystem elements, the elements of the ecosystem, right? And also of some masterminds. Because as you were saying things, I am getting validation for myself, because sometimes I feel I'm a split personality, that am I doing a lot, why I'm training the reception. But I still tell my reception that you are the extension of my life force.
Exactly.
The patients are judging me based on your behavior. And you have a choice that whether you want to evolve and learn something new, because I strongly believe in that nobody stays with anybody forever.
Yeah.
So I tell them, if you find some better thing in your career graph, you are free to, my heart will pain because I'm training you, but you are free to leave.
Exactly.
Just give us a 3 months prior notice so that we can arrange stuff. But utilize this time to develop your skills. If you are Shweta, you are handling my reception, don't bring your personal stuff inside.
Exactly.
Keep it outside. Let it be your new Shweta.
Like the moment you enter your practice area, that life should. I have a switch. I will not lie. I have a switch. Switch off किया. उसके बाहर कुछ भी हुआ या फिर whenever I am entering a chamber where patient is sitting, मेरा switch off हो जाता है.
And then if you have some issue, come to me.
If it is related to me, or if you want to discuss it to me, if you think it is your personal, then it should be outside the door.
Outside. Even if you want to have some, if you want to share something, that something is happening, maybe I want leave for a week.
Yeah.
Because then that person will have to give a background. Because I may be slightly furious कि भाई एक हफ्ते की छुट्टी यार कैसे काम चलेगा. So if you want to share something, share. But that is between me and you, or me and the seniors, whatever is there. So based on this, two awarenesses have come, because I strongly believe even now, like more now, that we need to operationalize our learnings.
Exactly.
Otherwise, the learnings are just like vague thoughts, they fly away. So one thing I want to operationalize from here on is that there should be some programs created, which actually I'm working on in the Future Next Labs, by the way.
Exactly.
So around staff management, and there should be classes of the staff as well, the reception as well. They should be having certain resources that they can see. Just telling them to do something will not do the job. We have to show them. So I used to do role plays, by the way. So yeah, I would make the staff sit. And I would say, you are Dr. Anupam, and I am the staff.
Exactly.
Or you are the
right.
So I would say,
you will ask a question.
Or I am the receptionist right now, and you are the patient. So come in a very cranky and complaining tone. क्या कर दिया है, बेकार है, सब दर्द हो रहा है, मुझे ये हो रहा है. So I would give two things. So firstly, so right now I am suppose Raghav. I am Raghav, and I am stuck in myself. You come. So Varun Sharma, patient comes and he says, ये नहीं हो रहा, वो नहीं हो रहा, दर्द हो रहा है, and Raghav is in anger. सर ठीक है, सर ठीक है, आपको फोन किया तो था, आप ही नहीं आए थे, अब नहीं.
Exactly, हाँ.
So see, and second is fine. Okay sir, please settle down. I totally understand you sir, please. Yes sir, बैठिए, मैं भी देखता हूँ. So I'm here to help you. Some words of reassurance. The patient just wants to be seen, felt and heard. आपने चाहे उनकी प्रॉब्लम जेन्युइन ना हो, चाहे उनकी ही गलती हो, बट आप उनको बताइए कि भाई प्लीज बैठिए, मैं आई एम हियर टू हेल्प यू, यू आर इन द सेफ स्पेस, यू आर द राइट प्लेस, लेट मी कंसल्ट द डॉक्टर, लेट मी गेट द डॉक्टर इन. सो ये जो स्टाफ की ट्रेनिंग्स हैं ये भी होनी चाहिए, बिकॉज अल्टीमेटली एक तो आपका इकोसिस्टम अच्छा क्रिएट होगा,
They are your reflection.
they are a reflection, and secondly it's a good practice management tool as well. Yeah, practice building, practice.
They are the practice यार. आप तो बैंक में 50% करते हो, 50% तो वही कर रहा है.
Yes. So that is the thing. So again, as we are coming to the mid of our first half of the podcast or the conversation, I would like you as well, as you are listening, because see, I have one complaint, not a complaint, just a request. I get phone calls and messages very often that Dr. Anupam, we saw the whole podcast and the podcast was really very nice, but please connect with us. Please get your comments, get your feedback, get what you want to know even more, or what you want us to know in the comment section below, so that we can grow together as a community, because I strongly believe in that when you share your learnings, we grow together. So don't keep your learnings to yourself, even if you want to share your nuggets, because as Dr. Dhruva was saying certain things, I was doing a self-reflection that almost the same things happen with me in my practice, right? So whatever are your experiences, you may say that, okay, what Dr. Dhruva said, I related with that because something happened in my private practice. So we can have those knowledge points shared, and we can have a virtual masterminding with regards to growing together. Yeah. So I really bank upon you for doing that. Please do that, and it will be a very nice gesture of yours towards the medical fraternity. Yeah.